Dear chairs, dear audience, it's a pleasure to see you here at the 12 months progress report. Let me introduce my PhD topic, which is about correlations of temporomandibular disorders with body position and posture. 30% of the population suffer from temporomandibular disorders. In addition, those who have forward head posture often suffer from chronic pain and decreased quality of life. Currently, the dentist has no awareness that FHP is associated with TMD. Therefore, the multidisciplinary treatment with physiotherapists routinely is very much lacking. This systematic review and meta-analysis showed that individuals with TMD are indeed 2.65 times more likely to exhibit FHP. Dentists should incorporate either a visual or an objective measurement for FHP in affected patients. Further researches are needed to investigate the effectiveness of multidisciplinary treatment to optimize treatment modalities. These data should be incorporated in the guidelines for the better awareness of FHP. My name is Dorottya Német. I'm a physiotherapist and a first-year PhD student. My vision is to improve diagnostic accuracy and quality of treatment for patients with TMD, and my mission is to explore physiotherapeutic interventions for the management of TMD. I am working on two main projects using the methodology of a systematic review and the meta-analysis for the first one, and the methodology of a randomized clinical trial for the second one. The title of my first project is Investigating the Prevalence Rate of Forward Head Posture among Patients with Temporomandibular Disorders. Temporomandibular disorders affect 2.5 billion people worldwide. There are many types of TMDs, but the common symptoms are pain, joint clicking, and limited jaw movements. We distinguish predisposing, initiative, and maintaining factors, and as you can see, muscle tightness is presented in all. The reason for this is the anatomical background of this area. The temporomandibular joint is connected with the cervical spine and the shoulders through muscles and ligaments. Postural problems, such as forward head posture, is increased among students and office workers, and the global prevalence is projected to be 32.5% by 2050. Based on this information, we hypothesize that right now many patients sit only in dental chair when they should be seen by also a physiotherapist. So my aim is to find out if there's a correlation between TMD and FHP. Here you can see my clinical question and the use PECO framework. The main outcomes are the presence of FHP and different cephalometric angles, such as the craniovertebral, the craniocervical angle, the cervical lordosis, and the CVT-OPT angle. And the clinical implication of this project is more effective treatment outcomes and less suffering for patients with TMD. So during the selection process, overall we analyzed more than 2,700 articles, and at the end of the process, 40 articles left included. And during citation chasing, we found 2 more. So overall we analyzed 42 articles. For the results, So let's see the results for which are presented with 95% confidence intervals. So the first figure shows the odds for FHP among patients with and without TMD. Knowing about FHP, the dentist can determine whether or not it is more indicated to send the patients to a physiotherapist in parallel with dental treatment. Overall, these 6 cross-sectional studies included around 1,800 patients. The reason for the high heterogeneity is the different types of diagnostic methodologies. Some articles use the DC-TMD, while others use the Helkimo index or the Fonseca anamnestic index. And one other possible reason for this is the different types of TMDs. The odds ratio is 2.65, meaning that the odds for the presence of FHP is 2.65 times higher in patients with TMD compared to healthy contrast, which is a clinically relevant result, as 1/3 of these patients had FHP. The second figure shows the mean difference of craniovertebral angle between patients with and without TMD. Measuring cephalometric angles can lead us to forward head posture, which can be also visible, but the angle data gives a more accurate picture. These cross-sectional studies included around 1,100 patients, and this figure shows the different types of TMDs. And as you can see, there's an inconsistency and no clinically relevant results in the mean differences of the CVA, possibly according to the insufficient data. In those articles where the type of TMD was not mentioned, the average, so the mean difference is minus 5.64 degrees, which is a clinically relevant result according to the literature. And almost 6 degrees has an importance in practice also regarding that the range of motion in the cervical area is maximum 16 degrees. The conclusion of this review is that CVA is an easy and objective metric for the FHP, which is 2.65 times higher in patients with TMD, suggesting that dentists should pay attention to postural signs and send the patients to physiotherapists. And future studies should focus on larger sample sizes in longitudinal studies. I have almost finished writing my manuscript, only some tables left to be included, and our target journal is the Oral Rehabilitation, which is a D1 journal with an impact factor of 4.0. The title of my second project is Comparing the Effectiveness of Online versus Face-to-Face Physiotherapy of Temporomandibular Disorders. Dentists and physiotherapists have two options for treating these conditions, the splint therapy and the physiotherapy. Right now, the gold standard is individual physiotherapy, which contains manual therapy and also active exercises. Since not many dentists and physios are an expert in this area right now, patients have to wait for months or even years to get their treatment. And thanks for the internet, patients can find many information about their condition while they are waiting, but it's our responsibility to provide safe and effective information for them. In view of this situation, my aim is to find out if online or group physiotherapy are as efficient as individual physiotherapy. Here you can see my clinical question and the used PICO framework. The main outcome will be the pain using the visual analog scale and the results of the DCTMD. And our hypothesis is that group and online interventions are not inferior to individual treatment. We will include adult patients with myalgia using the DCTMD, and we will exclude all systemic rheumatic diseases, children, or patients with trauma or previous jaw surgery. After meeting with an expert and considering that there's no available study using the same comparators, this will be a pilot study using 30 patients in each group. And let me share some special moments with you about my scientific journey in June in Barcelona, where I had the chance to present our work in a form of a poster presentation. And if you look at the picture on the right, that wonderful lady next to me is Professor Dr. Karin Bischer, a physiotherapist, whose research is presented in our paper. And I would like to end my presentation with a quote by Amelia Earhart: "Adventure is worthwhile in itself." Thank you for your kind attention.
Thank you very much for the nice presentation. That is the first.
Thank you very much for your presentation. It was really interesting. In your first project, Do you compare the prevalence of the mandibular diseases to the forward head posture, or the other way around? Because sometimes you were mentioning this way and the other way, or kind of both.
Thank you for your question. We chose articles where the population was adults and children also undergoing dental treatment or routine screening, and they were looking for forward head posture in among patients with TMD. So yes, we were looking for FHP.
Okay, so the population already has TMD, and you're looking for FHP in TMD population.
Yes.
Because I think sometimes you were saying it the other way, like forward head posture and looking for TMD, so that's why I got confused.
Well, yes, maybe it was then my fault then mentioning in the other way, but also in the future we would like to see the opposite. Because right now, of course, we don't know which was earlier.
Yes,
so,
yes, it's exactly.
Yes, we don't know that right now.
Okay, thank you for the clarification. Thank you.
Thank you for. Does it work? Okay. Thank you for a wonderful presentation. I would like to ask you, so based on your result, do you think postural assessment should become a clinical routine in dental practices for TMD patients?
Yes, I think that dentists should focus on quick measurements which are reliable for the presence of FHP, and that's why it's easy, because it also can be visible, but the measurement of the craniovertebral angle is also a quick one. So I think, yes, this should be a routine assessment for dentists in the future.
Okay, thank you.
Thank you for your presentation. What do you think of, about the psychological aspect of TMD?
Thank you for your question. Well, this is interesting because when I was at the conference, a professor came to me and asked me, don't you think these patients should only have a good psychologist? And and I said that, of course, these diseases, the TMDs, have a huge part on the psychological aspect. But I think it's more complicated, because after a huge stress or continuous stress, of course, the surrounded area and the muscles stay strained, and I think it's not that easy. And these patients also need the therapy by a physiotherapist to optimize their activities of the muscles. And also, if these patients don't get a quick treatment, then in long term, they also need the therapy by the dentist. So, like with the splint therapy also, or things like that. Thank you.
Thank you. I would have a quick question regarding the sample size of the second project.
Yes.
When you show that you have also a group intervention, it means that 30 people will be in one group.
Oh, the second one, sorry. Yes. 30 patients in the individual group, 30 in the group physio, and 30 on the online intervention.
And will be it effective with 30 patients in one group, in the group intervention? So, or will you divide it? That,
yes, I will. That 30 patient is the optimal is 5 patients in one group, but they will have this group environment.
Okay, and the online will be individual or this
individual.
5 people?
Individual with in an online platform.
Congratulations for your studies, and I have a question related to the first project. Did you identify in your examined studies any confounding factors which may influence the connection between forward head position and the prevalence of TMD? Thank you.
Sorry, I don't really understand the question.
So the connection between the forward head posture and the TMD.
Yes.
And my question was related to any confounding factors in the studies which have been analyzed, which can influence the.
No, we excluded all the studies where the patients had previous postural problems, such as spondylosis or things like that. So. No, we excluded
all of these factors were excluded.
Yes.